Hi, my name is Liv Panzer, and I have been affected by drug and alcohol abuse in my family.
The citizens of Luzerne County have been continuing to suffer from drug and opioid abuse for several years. This opioid and drug epidemic has heavily affected Northeast Pennsylvania. In 2018, there were approximately 156 overdose-caused deaths, breaking county record. The city of Wilkes-Barre, being one of the most drug and crime-stricken areas of the county, has a crime rate 93% higher than any other city or town in Pennsylvania.
Okay, my aunt a year ago was a victim of a prescription drug abuse problem and overdosed and passed away. The reason why I'm sharing this story is because it's a very common misconception that you have to be poor or a minority or living in a poor neighborhood, a bad area, to be around this substance abuse. But that's just not the case. My aunt grew up with everything she could have ever wanted. She was very wealthy. She lived in a very wealthy neighborhood. She went to college. She was beautiful. She was everything. And she still was controlled by drugs and pills and alcohol.
People all over Pennsylvania are affected by drug and opioid abuse. The misuse of and addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids, is a serious crisis that affects public health and safety. This crisis is also nationwide, considering more than 130 people in the United States overdose on opioids every day.
How easy do you think it is to obtain drugs in the Wilkes-Barre, Luzerne County area?
I think it's pretty easy. It's like almost every kid, high school, especially in Wilkes-Barre, lot of homeless, druggies.
78% of Pennsylvania counties, just like Luzerne, had overdose death rates higher than the national average. Last year, there were 137 fatal drug overdoses in Luzerne County. More than half of them the result of heroin laced with fentanyl. NBC reporters have gone as far as calling Wilkes-Barre the most unhappy place in America due to the rise of heroin overdoses. Though Luzerne may be a county of just 318,000 people, the heroin overdose-related death rate is 4 times higher than New York City. The Luzerne County must join together and find a solution to the drug and opioid epidemic that is hurting so many people countywide.
Want me to introduce myself first?
That's true. Yeah.
Okay, so my name is Cheryl Oster. I am the director of a local home health agency.
How has the opioid addiction affected your care of people in the community?
Well, since the opioid epidemic, what we've noticed is that like maybe 5 years ago, we had a higher elderly population that was very sick and a much lower population of patients who are, 50 years and younger. And now we're just seeing that population increase, and they're much sicker than some of our elderly patients.
Of these things, what is the biggest impact?
I think the biggest impact probably would be financially because these patients that have these opioid addictions, when we see them in the community, they're already discharged from the hospital, and then we go in like the very next day to take care of them, and they come home with multiple complications from the drug addictions. It affects their heart, and they oftentimes get sepsis from using dirty needles, and they come home and they need IV antibiotics for weeks at a time. So these people are very sick. Sometimes they have ulcers on their arms or wherever they were administering the drugs, and they have like huge wounds that need wound care. And oftentimes, they don't have anyone available because they've estranged all members of their family, and there's no one to help them, do the IVs and do the wound care when they go home. So that's a strain on the community.
If the problem persists, how do you see healthcare being affected over the next 10 years?
I think it's going to be a huge financial strain to healthcare as a whole, because a lot of these patients, unfortunately, because of the addiction, they're estranged from their family, and oftentimes they also can no longer work and they lose their health insurance. So that comes down to providing free care, which is very, very costly to the community.
So, what solutions would you recommend to prevent this?
Legislation, to possibly, be able to fund, healthcare agencies and hospitals to provide care for these people, because it's a financial burden to all of healthcare as a whole. So I think that would be something that's badly needed. Healthcare is in a crisis to begin with, and with the opioid crisis and our population of older people rising over the next 10 years, it's going to get to the point where we're not going to be able to afford to care for people, and hospitals and home health agencies are going to end up closing.
Another solution is just erasing the stigma of drugs. That is one of the biggest things. It would seem to be that it's the easiest because it's free and it's available, but it's actually the hardest. So just erasing the stigma of drugs is another one of the big solutions. Just knowing that it can happen to anyone. It's not entirely their fault. It is a disease.
How can you raise social awareness? Post on social media. Social media is the best tool that you can use to raise awareness. You can use Facebook, Twitter, Instagram, anything. Media is great. YouTube, anything. You can talk to your local representatives. You can vote. You can start your own interest group. You can talk to your friends and family. You can go door to door. You can hand handouts out to people with information. There are so many ways to raise awareness. Yeah!
Change is needed in the city of Wilkes-Barre, but obstacles such as funding and public awareness are standing in the way. Funding is needed to run programs fighting drug use and abuse, but citizens are opposed to higher tax. Without public awareness, the citizens of Luzerne County would continue to suffer from the dangers of drugs. A solution to this problem is volunteering and fundraising. This can gather funds for rehabilitation centers and make it more affordable for struggling citizens.
So we talked about how to raise awareness and what the problem is, and the last thing that we didn't talk about was how we can find solutions to this problem. There are a lot of solutions that could help with this opioid problem in Pennsylvania, but one of the biggest solutions that we could do is kind of make rehab more available, more accessible, because a lot of rehabs now, they're too expensive, and people who actually need them can't get into them, or you need to know someone who works there to be able to get in and lower prices and stuff. So it's really hard. So the way that we can do this is we can kind of raise taxes to help it become more available and help people that actually need help, to try and reduce overdose deaths, try and reduce people on the street because they're homeless because they used all their money to buy drugs, and it would just kind of lower a lot of rates and kind of make Wilkes-Barre and Pennsylvania as a whole kind of a more safer place, a more healthier environment, especially since there are a lot of kids in our community that are growing up. It's just kind of bad for them to be around.
Would you like to join us in making a change in Luzerne County? Search for the Anti-Drug Pug on Twitter. Doug tweets about the drug and opioid epidemic and different fundraising opportunities to attend throughout the community. In Doug's bio is a GoFundMe page for more affordable rehabilitation in Luzerne County. Click the link and donate now.